For those of you who have been with us in the past, thanks for being back. For those of you who are new, welcome. We hope that you enjoy your time today. Our lunch tables are intentionally pretty relaxed and conversational in nature. We do have a guest speaker, but they take questions throughout our time. We want it to be pretty relaxed and laid back. So you can either raise your hand if you want to ask a question and we'll unmute you so you can ask, or if you want to type in the chat. Sandy and I kind of pay attention to the chat box, and we'll let Eric know if there's any questions that are hanging out over there in the chat box. So I'd ask that everybody go ahead and mute themselves now, just so we don't hear the background noise, the Amazon guy making his delivery, or the dog barking, or the baby's crying. We're all used to those things in today's Zoom world, but they can be distracting for you and for us. So if we can just minimize those, that would be great. We will take a break. Eric does his introduction and presentation this morning. We'll take about a 10-minute break so you guys can grab your lunch. Come back to the Zoom table where you find an invitation to join a breakout room. The purpose of those breakout rooms is to give you an opportunity to network with who else is here, and also just to have some open conversation. Usually the conversation is geared around the topic of the day, but if there's something else that's really on your mind that you want to talk about, that's great too. But we want it to be a really productive time. So grab your lunch, come back, join us for sessions, and then pretty close to 12:30, 12:35, we come back, we talk about what we talked about at lunchtime, kind of do a share out moment, and then we do a Q&A with Eric. So that's kind of how our day will go. I know that today's subject can be a little heavy. Usually if we're having this conversation live in the room, we would let you know to kind of signal us if you're being triggered in any way or need some assistance. Because we're not together and we're doing this live, if you are that person who maybe would like a side conversation or need some help, if you message me personally, I'm happy to either call you if you would like that, or we can have a side chat conversation, whatever you need the most at the moment. We really do want this to be a comfortable and safe space for you. If you need to just kind of step away for a little, that's okay too. Again, because we're not in the room and in person, I won't know that. So I just ask that you be safe in the way that you're handling this conversation and make it as comfortable for you as you can be. And Eric may have more guidance in that direction moving forward. So without any further conversation, I will introduce you to Eric Evans, who is the Northwest Indiana Suicide Prevention Council lead. He's head of prevention at Geminus. Introduce yourself to our group and take it away.
All right, good morning. So I had to look at the clock real fast. Still good morning. Thank you all for being here. For those of you who are here live on this opportunity to talk through this topic, as well as those of you who are going to be able to view it at a later time. I am with Geminus Corporation. I'm the director of our prevention services department. And so, you know, we work on suicide prevention, mental health promotion, substance misuse prevention, just really, you know, emotional behavioral wellness. One of the pieces that we coordinate is the Northwest Indiana Suicide Prevention Council. There really is, I would say there's no lead to it, Donna. Maria Elena Trejo within my team does coordinate it, but it truly is a collaborative effort. And Donna and Path have been phenomenal partners for years now, working to address suicide prevention, helping people to connect to treatment and intervention, and supporting doing what we can to help support people after a suicide. So at any point, if you're interested in learning more about the Suicide Prevention Council, we're always looking for more organizations and individuals who want to come to the table and see what can be done. We work in Lake, Porter, LaPorte, Jasper, and Newton counties. So we would love to connect with you. So you can always reach out to Donna or myself. I also have, you might see a gentleman, Aaron Cohen, here with us. He is new. He's an AmeriCorps member who is going to be working in supporting suicide prevention efforts in Northwest Indiana. And so you can always connect with Aaron as well, and he'll work with myself and Donna and the team to do what we can to help you. So, sorry, I digress at times, so you will notice that throughout this conversation. But I am very thankful that you are here today. September is the month for suicide prevention awareness. And so I think this is a great opportunity to bring this conversation to the forefront. So with that, I am going to get started. As Donna stated, please don't hesitate to interrupt me. Just unmute yourself and just jump in, or like Donna stated, you could raise your hand. You could put it in the chat box, but please do interrupt me, because I even get tired of listening to myself talk for such a long time. I can't imagine you listening to me talk for this entire time. So please don't hesitate to interrupt me. I appreciate the questions. So I'm going to get us started with the screen share, and let me get actually to the beginning of the presentation. All right, so we should be up and running. So we're going to be looking today more specifically at youth suicide. I'm going to be talking about suicide in general, but I'm going to be taking a heavier focus looking at youth and what are some of the contributing factors. And so we are going to have a portion of the conversation today looking at the impacts of COVID and the pandemic and kind of what that is doing and what we are starting to see with some of the numbers and some of the research around youth suicide. As Donna stated, this is a very sensitive subject. A lot of people don't talk about suicide on a regular basis. A lot of people don't talk about suicide at all. Unfortunately, there is still a stigma in our society around mental illness. There's still stigmas in our society around suicide and around treatment. This could be hard for some people to have this conversation. If you need to step away, please do that. Please take care of yourself. But I strongly encourage you to reach out to Donna, just because you shouldn't have to be alone. And no one is alone in suicide, and we don't want people to feel alone. And so please reach out to Donna, and she can be there to provide you the support that you are looking for and you're needing at this time. But while this is a sensitive subject, it's a very important conversation to be had, because we don't have this conversation often enough. I think if we can talk about suicide and we can, we're not trying to normalize suicide because we want to prevent suicides. But if we can talk about and break the stigma around suicide, and we can break the stigmas around asking for help, then we will be able to prevent more in future suicides. I always like to start with just some working definitions, because I think it's just a good way to get everybody kind of on the same page. When we're looking at suicide and we're looking at suicide attempts, there's a lot of different layers and levels to it. There's a number of different kinds of assessments people can use, like the Columbia scale is a very common one to assess somebody's risk of suicide. Within there, there's different levels of risk. We're going to be speaking more around 3 different levels today. The first is suicide. And suicide is a death caused by self-directed injurious behavior with the intent to die as a result of the behavior. A suicide attempt is a non-fatal, self-directed, potentially injurious behavior with intent to die as a result of the behavior. But it's important to keep in mind that a suicide attempt might not result in an injury, and not every suicide attempt is going to necessarily be known. Not all suicide attempts are going to require someone to go to an emergency room or to seek medical help. And so it's really hard when we're talking about the data pieces to collect data around suicide attempts because of that. And then the third concept that I'm going to introduce is the suicidal ideation. And so this is if someone is thinking about, considering, or planning a suicide. And so we're going to kind of combine those elements together into suicidal ideations. And we're going to move into looking at the prevalence of suicide, looking at the numbers, because I think the numbers have really can help to guide us in what we can do to help prevent further suicides. One of the things that was really interesting for us to see is within the past 2 years, the suicide rate in the United States has gone down. The 2020 numbers with the asterisks around them is because that from when I last checked, those were not the confirmed final numbers, but they were what the final numbers, according to the CDC, was identifying are the projected numbers, which there's a lot of questions around that. The data here goes back all the way to 2010. In 2010, there was 38,364 Americans who died by suicide. That number kept increasing year over year over year. 2018 was when we reached the highest number of 48,344. There was a decrease in 2019, and then again, we're showing a decrease in 2020. Don't really have any answers as far as why that is. I'm actually pretty intrigued with that. I know that there are people on the state level and the national level who are doing some research and trying to better understand what was going on. Was there an increase in people getting seeking assistance and getting help? Was there were preventative efforts able to connect with people before they got to the point of a suicide attempt or death by suicide? So I don't have the answers to it, but I think just kind of knowing the numbers is really important and beneficial for all of us. We do know that suicide, it is the 10th leading cause of death in our country. This is going to be because the 2020 data isn't confirmed yet. This is the 2019 data. So you see that the #1 leading cause of death in 2019 is going to be related to heart disease, followed by cancer, accidents, unintentional injuries, respiratory, strokes, Alzheimer's, a few other kinds of ailments along the way, all physical health ailments. Suicide, again, with an intentional self-harm for the intent to end one's life, is the 10th leading cause of death nationally. So this was the 2018 kind of data chart here that I like to share because it highlights the leading causes of death per age group. And you see here that suicide is the 2nd leading cause of death from the age of 10 up to the age of 34. Unintentional injuries, accidents are the leading cause of death. We do see suicide dropping down to the 4th leading cause of death when you get into the late 30s into your mid 50s. And then it drops even further down once you get 55 and older. However, I think it's one of the things I like to look at, and I think it's interesting that they highlight homicide. We talk about homicides a lot more in our society. We talk about preventing homicides and stopping homicides, but we don't have that same kind of focus and the same kind of conversation happening in our societies around suicide. And I would hope to believe if we can continue and have more of these conversations, that we would be able to come up with better strategies, that we would be able to connect with even more people to help prevent further suicides. So the 2019 national ranking of suicide per state, and this is going to be looking at per 100,000, Indiana actually made a pretty good jump in the positive direction. So the state with the highest rates of suicide in our country is Wyoming, followed by Alaska and Montana. The states with the lowest rates of suicide, well, DC, which isn't a state, but DC has the lowest rate, followed by New Jersey, New York, and Massachusetts. Indiana, and according to the 2018 data, was right there in the middle. I think we were number 26 in 2018. So, and I think at that point, that was like around 15.8, I believe is where we were at in 2018. And we dropped now, our 2019 data shows an improvement to 14.2. So I would be interested, why do you think Wyoming, Alaska, and Montana have the highest rates of suicide in our country? You can either throw it in the chat box, you can unmute yourself. I'd be interested in people's thoughts.
Yes, this is Travis. I was calling because sunlight.
Okay. Sunlight, the kind of thinking about like seasonal depression kind of
Yes,
thing?
because I think with more sunlight, when you have less sunlight, you have more depression.
Okay. Thank you. And with this, there's not really any right or wrong answer, because we know suicide is going to be unique individual to individual. But yeah, I mean, that is definitely something that you can tell between those top 3 states. Thank you.
I think you can also add isolation to that. Wyoming and Montana have large open areas, probably with lots of people who are in very little contact with other people.
That's true.
Yeah, I think the isolation, it makes you, with the isolation, I think about access to care. You know, if there's small villages or small communities that are of great distance to one another, do they have counselors and therapists and mental health centers accessible to them? Thank you. Any other kind of thoughts here? Let me jump in the chat box. Less resources available. Yeah, the isolation. Limited resources of fresh food. I think that's a really interesting observation that Emily brings up. You know, because I think with the sparring distances, I don't really know
This is interesting, John.
a whole lot around kind of the correlation, the direct correlation that you might know about, Emily. So if you have any further, I'd love to hear about it. But I think it's just kind of this notion of the isolation and limited resources and possibly like food insecurities and things of that nature can put people at greater risks. The light, isolation, resources. Yeah, I think a lot of people really hit on the isolation, which is key. And then additionally, it was possibly adults not realizing it's depression and thinking it's puberty. Yeah, there's a series of trainings that kind of look to trying to train people to better understand the differences between typical adolescent development and the onset of a mental illness. Because we do know that oftentimes a mental illness, a lot of mental illnesses start to appear in the teenage into the transitional age. At the same time, hormones are really kicking in and causing young people, all of us at one point went through the same thing, causing all of us to make probably decisions that probably had, you know, adults in our lives scratch their heads. I think it's important for people to be able to learn the distinction between the two. Oh, so kind of, thank you. So Emily added more into the chat box stating, you know, that her mother lives in the desert of Arizona and a grocery store is an hour away. And so the population eats Spam, potatoes, and nothing vibrant or fresh. And so looking at how diet—
That makes a lot of sense. That's right.
Diet
I was wrong. I'm thinking of sunlight, but you're right. Isolation.
Yeah. And how food and the impact that fresh food can have on our body and our mental health. So thank you for adding that additional information. And you can really see a stark difference between those large sprawling states to the states that have the lowest rates of suicide. When you think of New Jersey, when I think of Massachusetts, and even New York, even though upstate New York is going to be a bit of a larger space, but there's still just overall going to be greater resources because of greater population. And so I was happy to see Indiana moving in the right direction in hopes that we can do some support. But it's important to keep in mind, though, even here in Indiana, there are going to be times in some of our counties, you know, the ratio of residents in some of our counties and in our state to licensed counselors or therapists I mean, we still have people here in our state who have to travel 45 minutes to an hour one way just to get to be able to be seen by a mental health clinician. And so I think it's important, even in our state, you know, while in the Northwest here locally, we do have resources that you can get to in a shorter distance. We do have parts of our state that are still pretty rural, that is more challenging to get to resources and access to care. It's important to remember for all of us that suicide touches everybody. Suicide does not discriminate against anyone. So it's all ages, all incomes, all racial, ethnic, and religious groups, all genders or sexes or sexual orientations or identities, all parts of our country, and it is impacting and touching all parts of our state. Suicide is not somebody else's problem. Suicide is everyone's problem. And it's something that everyone can step up to further educate themselves and to be able to help prevent future suicides. So this is a very, very simplistic way of thinking about suicide. But I think it's an interesting way to think about it, especially when we're thinking about young people. We know everyone is going to come upon stress, or everyone's going to come upon problems, or everyone is going to, at times in their life, they're going to feel depressed or they're going to feel anxious. That doesn't necessarily mean that they are diagnosed with anxiety disorder or depressive disorder. But we, as humans, we have stress in our lives. It's important for us to remember that the young people in our lives also have stress and they also have problems. But you can start to see when someone maybe doesn't have coping skills or doesn't have the resources or the ability to seek out help. And you start to see people who do have mental illnesses or other mental health issues, such as depressive disorder or anxiety disorder, can lead people down a dark hole and can lead people into isolation. Fewer people think about suicide. Suicide is not something that every person is going to think about as an option for them. But there are people who do think about suicide as an option. Full disclosure, I've thought about suicide. Full disclosure, I've attempted suicide before. It's when people learn that they can get help. When people learn that there is an option or an opportunity for them to get out of kind of the pain that they're experiencing, is what we can do to help people who are suffering. So we want to be able to connect with people. We want it to stop when somebody starts to think that there's no option for them to end their pain, then suicide. So suicide, kind of with youth, I like to kind of think of two different kind of aspects of it. Looking at stress, the ways that our mind and our body responds to challenges and threats. Stress is not a bad thing. Feeling anxious is not a bad thing. Feeling anxious is actually kind of a good thing for us, because if, a ball rolls into the street and there's traffic coming, you get a little nervous about going and grabbing that ball or not. That little nervousness, that anxiousness, it can stop us and make us think, you know what, maybe we shouldn't go run out there in the street and grab that ball. But we need to learn, and we need to learn the skills and the resources and the tools to be able to manage stressors, to be able to manage anxiety. So what do people think are some of the stressors that our youth and our teens are facing today? Throw it in the chat box, unmute yourself. What do you think stresses kids and youth and teens today? School. Social pressures, body image, home life, basic needs, feeling secure, home life, yes. Did you have something, Lisa? I thought you unmuted.
Oh, yeah, I was just gonna say conflicting messaging and the COVID pandemic.
COVID, conflicting messaging, social media. I know that I'm glad I grew up when I did, because I don't know how well I would have managed social media. Lack of attention, not feeling loved was also included in there. Family issues, teachers, relationships, family relationships, friend relationships. There's a lot of different things, when you think about our own stressors and what we what we deal with on a daily basis as adults, we know that our young people in our lives also have stressors. And sometimes they pick up the stressors that we as adults carry around, because we might unintentionally be dumping our stressors on our young people in our lives. If there's like financial stress in the home, that might, your young person in the home might feel those stresses as well. The schools, and the way in which there's a lot of testing that kids have to do, and the constant changes to what is expected of them to be able to graduate with a certain kind of degree, being able to feel as though they are equipped to get out into this big bad world and make a living. There's a lot of stressors that can happen. But stressors can come from, I was about to digress, but I caught myself. So that was a good one, because I gotta pick it up a little bit. Okay, stressors. When we're talking about depression, I was talking about depression a little bit ago. It's the feeling of intense sadness that can last 2 weeks or longer and keep a person from functioning normally. So depression as a mental health disorder or a diagnosable disorder would need to be done by, a clinician or a provider. But it's important to remember, when we're looking at depressive disorder, we're looking at depression, that it is a treatable illness and that it is not the person's fault for being depressed. And there's different kinds of causes. Some of it is brain chemistry. Some of it is just how we're created as individuals. Others can be situational. They can be stress-induced, trauma-induced, based upon experiences. So I think it's important, really important for us to remember, especially with our young people, they come to us with experiences that they have lived that we might not know about or we might not fully understand. So it's important that we keep those in mind as we're working with and connecting with our young people. And we know that experiencing depression as a youth, that it can put individuals at a much greater risk for poor health outcomes as adults. Emotional distress can lead to contemplating suicide or suicidal behavior. And we know that there are specific groups in our society and in our communities that are at a much greater risk of suicide. And we'll talk about those here in a moment. But I wanted to look here at some of the impacts that COVID-19 is playing in our world, the impacts that it's having on our stress, and the impacts that the stress can then lead to poor mental health and or suicidal ideations. And I think it's important, if we're talking about youth, that we need to talk about parents. We need to talk about the home, and the family in the home was one of the areas that a lot of people just mentioned as being a stressor in kids' lives. Parents are dealing with burnout. We're seeing with parents, struggling with, unemployment or consistent, steady employment. Limited social support. Our social supports have really gone up and down a lot during the past 18, 20 months. There are some organizations that are no longer providing support, and there's other organizations who are providing support, but maybe in a different facet or a different delivery model than they have done previously. With the unemployment, financial insecurities has been a hard thing for a number of families. And, as a parent taking on that burden, it can really create that stress in you, which is hard to be able to manage and to be able to not then indirectly expose that same kind of stress or burden onto your children or the other youth and the kids in the home. There has been a lack of activities with COVID. There are certain things that we've been able to do, certain things we have not been able to do, but being able to find those opportunities is not always readily available for all families. For some families who have the opportunity and the privilege of being able to to drive or travel to a space where they can go and social distance and do activities. Not all families have that accessibility, might not have the financial means to do it, and might not have the time to do it because of their employment schedule. Loss of childcare has been a big struggle, especially when more schools were operating remotely and figuring out what to do. You know, the challenge between working and having your child or the youth in your home learning from home was a huge stress and a huge burden. And we actually are seeing that is impacted on, we see that it has impacted women more than it has impacted men, as they've been kind of tracking the unemployment rate, that it is more women who had to step away from their jobs, unfortunately. And more women have been slower to re-entering the workforce because a lot of the uncertainties around childcare and a lot of the uncertainties around our school system. Donna mentioned here, domestic violence rates increased as well during COVID. And I don't know if I have domestic violence, but I have a different one that we're going to look at here in just a moment. See, good minds, good minds. And then family health concerns. You know, just looking at kind of the concerns of, am I at risk of getting COVID? Is there any pre-existing conditions, concerns for myself, concerns for my family? You know, kids with pre-existing conditions, vulnerable health, possibly parents in the home. So there's a lot of different ways in which COVID has really put a lot of stress and burden on parents. And that stress and burden can easily funnel down and get into our kids. We know that there has been increased isolation amongst our youth. We are social creatures. We need to be together. I'm glad we're together this way, at least for right now, but most people like gathering and getting together with others and being able to connect with others. And so we know that there has been increased isolation taking place because of COVID. And we know that 14% of parents, have reported worsening mental health for their children. And we know that there's been higher rates of kids being clingy, higher rates of being distracted, irritability, and fear. And this data I got from Mental Health America. So some of the big areas that it's really been impacting our kids is schools, our school closures. Adults have a lot of different opinions on what is right. And so I'm not going to sit here and say what is right, because each of us kind of has our own process to determine that. But we do know that we want our kids to be in school. The kids that are able to be in school, we want them to be in school. And so there are certain health measures that have been put into place to allow that to happen. Because when the schools were closed and kids were learning more remotely, they were having less interactions with their peers. And with that less interaction with their peers, there's growth and learning that takes place through play. And that was not as readily available. There was decreased physical activity that our youth were experiencing when learning from home. But we also saw that youth were, because of unemployment, because of people losing their jobs, that there was oftentimes losses or disruptions in health insurance, which has then caused some interruptions and disruptions in the medical care and medications and things for our kids as well. And there has been increase in child abuse and maltreatment, but then you're going to also see here that there's been lower numbers of reporting. So when we're looking here specifically in Indiana, the blue line is going to be 2019 and the orange line is 2020. And so this is child abuse and neglect cases, case numbers in Indiana. And so they were slightly higher in 2020 than they were in 2019. And what's interesting is they peaked really high in the month of July. Don't know why, but I thought that was an interesting observation. So we're going to look at calls to the hotline, and calls to the hotline specifically are for child abuse or child maltreatment. There were fewer calls, substantially fewer calls in comparison to the 2019 data. And so this is an interesting thing because the only thing that I can think of that can relate to this, and the others might have better ideas or theories as to why. But I do know that one of the things that our teachers and educators have said is that it's much harder to read and gauge where a child is at emotionally through Zoom when they were remote. You know, when you have a child in your classroom, you know, hopefully for an entire school day, you know, the teachers and educators are able to build those beautiful rapport and relationships with their kids and can better hone in and identify if they suspect mistreatment in the home. But when the kids are in the home and they're not as readily interacting with other adults who could be caring adults, that it could lead to that. So right there, this was very well articulated. Thank you, Marion. We were all in our home, so the public didn't see evidence of abuse firsthand. And so I think that is definitely something to think about and the impact that that's had. I don't have, I didn't include the data, and if you're interested, maybe reach out to Donna, but she reported that the domestic violence rates also increased during, as a result of kind of during our pandemic time. So I'm going to kind of go through these a little bit quicker because I do want to get to some kind of things, best practices, or some strategies of ways that we can look to help. So we do know that there's overall in our country, there's been increased substance use. So this is again data from Mental Health America that says 13% of Americans started or stated that they increased their substance use because of COVID-19. And again, we know that a big part of that has been social distancing, which has led to increased isolation and increased feelings of loneliness and reduced access to treatment and naloxone. And so when we're looking at reduced access to treatment, a number of our mental health centers, our behavioral health providers moved to telehealth. You know, inpatient services were still available in some locations, but maybe on a reduced scale. And telehealth might not have been the kind of treatment or access to care that is going to work for everybody. And so we also know that among individuals with COVID-19, those with a substance use disorder had much worse outcomes as far as how the virus impacted and negatively affected their overall health. So reduce access to naloxone, that is kind of a direct correlation looking here at the deaths due to overdose from January through June. And so this is going to just take kind of like a 6-month snapshot of both of those years. You see that the yellow color, I should pick 2 different colors, so a little too close together, I apologize. The color on the bottom, it is going to be the 2019 data, and then the green is going to be the 2020. So you do see that this was pulled from the Department of Health, that there were more Hoosiers who died by an overdose. And so it makes you wonder, again, not being engaged, possibly not having access to naloxone to be able to reverse some overdoses have taken place. I think it's also interesting, you know, when I think back out to 2019 and kind of the field in which I work in, which is within substance misuse prevention, we were all talking about overdose, and we were all talking about opioids. And COVID hit, and it's almost as though from a societal perspective, it went away. But in reality, it didn't go away, it actually got worse. And then that's what this data is here to show. So 41% of Americans, again, according to Mental Health America, experience adverse mental health or behavioral health events because of COVID. And here in Indiana, when looking at the self-screeners, that depression, bipolar disorder, anxiety were the 3 most common self-screeners that Hoosiers were taking. So the National Suicide Prevention Lifeline call volume And this is going to be looking here specifically at the calls that were made in Indiana. And you see that the dotted line shows a steady increase from February of 2020 through January of 2021. So over this year time frame, the calls increased by 101%. For me, it's kind of this, it's alarming because it shows that there are more people in need. But the thing that I think is that I look at, I'm like, all right, this is good, is that people are using resources and that people are reaching out and asking for help. So I think it's the kind of this double-edged where it shows more people are at risk and more people are struggling and suffering, but it also shows that more people are getting help. And I'm happy to see the help seeking, people help seeking.
Rick, I'm also wondering if people are just more comfortable getting help not face-to-face, or just having those not face-to-face conversations. They're used to picking up the phone or getting on Zoom. And so talking about your feelings or expressing yourself in non-traditional face-to-face ways has become more comfortable.
Yeah, that's an interesting thing. And I don't know, Donna, you know, because the pandemic has really thrown the whole way in which a lot of services have been provided. And so I think what's interesting here is this looks specifically at kind of that young, kind of our teenage and like the young adult age range, and looking specifically in these age groups at the calls. While we do see that there was consistent, you know, the 12 and under. So, I mean, those are babies, let's be honest, 12-year-old and younger, those are our babies. You know, there are some on a monthly basis that are reaching out for help, which breaks my heart to know that they're struggling. But you really start to see the lighter green color, which has the highest rate. That's going to be our teenagers and our transitional age adults. The 13 to 24 is that lime green color. And you see that there's these huge spikes and large increases in those calls. And I think what's interesting is you see a big increase that happens over in the fall of 2020. You know, it makes me kind of wonder, you know, what impacts of school and those kind of life changes were happening. Because March of 2020 is where you see, you know, is when everything started, and you just start to see the numbers rise from there across all three of those age groups. So I'm going to move back into just a little bit of just general data. We know that 15.7% of our youth in Indiana between the ages of 12 and 17 reported suffering for at least one major depressive episode in the past year. And we also know that nearly 1 in 3 of our high school students felt sad or hopeless for almost every day for at least 2 weeks. Again, that doesn't mean that 1 in 3 of our high school students suffer from depressive disorder, but it indicates that there is struggling that's happening amongst our high school students. So doing kind of a breakdown, and I'm not going to go heavy into this, you can kind of see real quick. Collectively, Indiana has higher rates of students reporting feeling sad or hopeless for 2 weeks or more in comparison to the national average. The highest is 10th grade. And it's interesting because you're going to see 10th grade also being the highest when we're looking at the percentage of students who considered attempting suicide. And this again was 2019 data that was collected by the Indiana Prevention Resource Center on their Indiana Youth Survey that they administer. Again, 10th grade is going to be the highest. And you're going to start to see it's also the highest when asking the students if they made a plan to attempt a suicide. And it was 14.3% again for 10th grade across the state. I don't know why 10th grade. I know that there's a lot of things that are happening, you know, and hormones and changes, and you know, you're not a kid, but you're not an adult. What is your future going to look like? I don't know. I think it would be interesting. Bullying, somebody just threw out there in the chat box. There's a lot of different things that can really play into that. So that equates to 1 in 5 of our high school students seriously considered suicide in the past year. And so our kids are 15% more likely than their peers nationally to consider suicide, which is heartbreaking. I'm going to skip these because gotta pick up a little bit more time. Talking about some groups that are at much greater risk, the LGBT community, our LGBTQ youth are 3 times more likely to consider suicide and 5 times more likely to attempt a suicide in comparison to their cisgender or heterosexual peers. We know that our female youth are twice as likely to consider suicide compared to our male youth. And the Hispanic youth, so around 15.5%, are more likely to attempt suicide than their Black African-American peers, which was 14.5%, multiracial youth peers at 10.5%, and their white peers at 8.7%. So this was data that was kind of pulled together by Dr. Chris Japro. He was previously at Valparaiso University. He is now at the Division of Mental Health and Addiction, spearheading the suicide prevention efforts for the state, which is fantastic. But he created this chart for us, and it shows from 99 through 2017 suicide rates by age group. And I think it's really important to see these large jumps and this quick increase from the ages of 10 upwards to the 25, kind of that transitional age adults, that 20 to 24 age groups. But I always think it's interesting because we do talk around suicide prevention a lot with pertaining to youth, and it's very important that we keep that conversation going. But in the state of Indiana, middle-aged, so kind of that 45 to 49, white men die at the highest rate of suicide in our state. You do start to see that it is going to decrease. The rates of suicide do decrease in 50s and 60s. But once we hit into the 70s, mid 70s, we start to see the rate of suicide increase again. And so I think it's really important for us to think about our elder population, knowing that we have a larger increase of individuals who are aging into that elder population if we're going to continue to see that increase in suicides or deaths by suicide in older adult populations. So some of the risk factors, some of the things that put youth at greater risks of suicide, just because the risk factors are present doesn't mean that they are suicidal, but these are things that can put youth at greater risks of suicide. If they suffer from any mental disorders, particularly the mood disorders, if there is alcohol or substance disorders or excessive alcohol or substance use. The big one is hopelessness. Feelings of hopelessness and helplessness is a key risk factor. Impulsive or aggressive tendencies. We do see young people, we know that their brain is still developing. Our teenagers, their frontal cortex is not all there yet. Their ability to ration and reason is still growing. And because they can be impulsive, puts young people at greater risks of suicide. If there's a history of trauma or abuse, physical illnesses, previous suicide attempts, family history of suicide is something to keep in mind for people to be at greater risk. Because if suicide was an option for another person who was maybe close to them, maybe it was a family member or even possibly a close friend, it makes suicide a more of a viable option for a young person. Job or financial loss, loss of relationships. Loss of relationships can be a variety of different things. It could be a romantic relationship, but a loss of relationship could be amongst, like friend groups, or the relationship between a child and their parent. Maybe their parents are getting separated or divorced, and the child feels as though the relationship with one parent has been severed. Those are losses of relationships that can put a young person, or really anybody, at greater risk of suicide. We know when individuals have easy access to lethal means, the rate of suicide does increase. If access to those means is more limited, we do know that it does save lives. There have been local suicide clusters, lack of social support, isolation, big one that we've already talked about quite a bit today. Stigma associated with asking for help. We talked about the stigma quite a bit already earlier, but it's important to really think about what that stigma looks like, because community to community, I mean, it can be amongst racial and ethnic groups, it can be amongst different religious and faith communities, it can be this notion of rural, suburban, or urban. There's a lot of stigma still around asking for help or airing the dirty laundry of the family or things of that nature, which really prevents people from getting the help and the services that they need. So the big warning signs to look for, I think the obvious one is talking about dying or wanting to kill oneself. When we're thinking about talking about it, I also want to interject, that also means if they're writing about it or posting it on social media. If you see that someone is starting to look for ways to end their life, or sorry for my typo, searching online or buying a gun can put is a big red flag. When people are talking about feelings of helplessness, having no reason to live, you know, you have somebody who, you know, poses that odd question of, you know, would you come to my funeral if I died? It's not typically something that people are just going to ask. And, you know, like those kinds of conversations or those kinds of talking, it's not the directly stating, you know, I'm thinking of dying or I'm thinking of suicide, but in kind of those indirect ways. Feelings of or talking about being a burden onto others, increased substance use, because we know what if somebody's under the influence of alcohol or drugs, their ability to think rationally decreases substantially. And then also acting reckless or agitated. There's been more research looking into sleep patterns around suicide, looking at sleeping too little or sleeping too much. It's hard to do when you're talking about teenagers because their sleep behavior is going to be all over the place anyway. Withdrawing or isolating themselves. And so you can kind of see this with young people. I have littles. I have an 8-year-old and a 5-year-old. And so right now I'm still pretty cool. You know, my 8-year-old still likes me, but I do know that he's going to get to that age where he's going to be pulling away from, you know, like the family, the parents being like the coolest, and going to be, you know, pulling more into his peer group, his friends group. What we got to keep in mind with young people is they're going to move from one kind of social group to another social group. And, you know, they get into high school and they start to make different kinds of friends. What's alarming and a red flag is if you see them no longer with a friend group, but they don't replace that with a new friend group, that they pull away from who they were previously acquaintance or friends with, and they're not moving into a new group. That's the isolation we really need to look for in our teens and our preteens. Extreme mood swings, hard to really tell with teenagers, but we want to really kind of hone in on what's happening. And then giving away of prized possessions. So what to do, and I only got a few minutes left, but I would be interested in kind of hearing from you all. What do you think could be done to address more of the pandemic related stressors that are on kids? Because all of those risk factors you can see coming from our schools closures, remote learning. We talked about the isolation, loss of the interaction, decreased physical activities. We know the benefits of being active with the dopamines in our brains and our overall mental health. What do you think what are strategies or what are things that you would suggest to parents or to your peers, or even sometimes maybe suggest to yourself as ways to better help and support our kids in these questionable times to address kind of these different pandemic related stressors that we know our kids are facing today?
I think that while social media can be a really negative thing, especially for our peers or for our teens, because only the best life is put out there for them to see, right? So they're disappointed if they can't measure up or whatever. or the, of course, cyberbullying situations. But I think if we could create social media groups that are safe for teens, a place for them to hang out. I know as we were trying to continue a mentoring project that we had, we had Remind groups, and we had some Google Classroom groups that were meeting once a week just for support. It was a place they could get on and hang out, so to speak, and really share what was going on. We talked about their highs and their lows, and it gave them a place to be vocal. So I think just like when we're in school, we want to make sure that they have safe places to have conversation. When they can't congregate in person, we still need to provide them with safe spaces to be able to hang out and talk about what they're going through and what they're dealing with and what they're feeling.
Helps them to stay connected at the same time. So I think that's great. Gary posted, provide calm assurance that we will get through this pandemic. I really love your use of calm assurance, that this will end and become a part of our history. And so I think, I've even talked kind of the history aspect of this with my kids, my 8-year-old and 5-year-old. We've talked about other pandemics that have happened, and that, we will get through this, and we will grow and be better from it. Don't know how at this point yet, but I'm confident that we will. Have PTA meetings with you, informing parents that you are sharing with us, and make it something that kids and parents can do together. And afterwards, they can have parent-child conversations if they want. Yeah, I think, finding those connections, those opportunities for our educators, our educators, they have so much on their plate. Educators, their job used to be to teach content. Nowadays, our educators are really put into wear a whole lot of different hats. Lisa says providing positive, safe social media sounds like a great idea. Weekly check-ins. I love this idea of weekly check-ins. So thank you. Stephanie, I think you have your hand raised.
So one of the things that we found as a family that ended up being a huge bonus to our children, we have twin girls. They are 11. One of them has significant special needs, and her sister has to balance that out in her life and handling that as well. And we had started a few years ago behavior therapy for them individually and collaboratively. And with COVID, when that originally stopped, both of them really began to struggle. And the minute their therapist offered telehealth, I jumped on it, because I can be mom 24/7, but there's certain things our kids just don't open up to us about, and they don't want to discuss with us first. So having that as an opportunity for them to continue, and now they're back in person, that really helped them get through the pandemic, being stuck at home together. We live in a very tiny house. So, having to deal with everything they had going on with not going to school or seeing friends or doing all their activities, and then being stuck together, having that outlet and continuing that throughout the pandemic. And even now, they still continue that. And they've been doing this for a number of years, just as a way to give them an outlet that's not us as their parents.
Those opportunities to connect with others, because one thing that you do see that I've seen, and that you don't always understand, is why do kids identify that one adult as someone that they can trust? And then that's the thing, is we don't ever know who we might be that one adult for. And so if you can just leave yourself open and available for that one young person to turn to, that they feel safe to connect with you if there is something that is bothering them or concerning them, or they're struggling. And we don't always know why there is that one adult, but in this situation, you kind of spoke about your children being able to find and have somebody who is that one adult, and then being able to work to find a way to still allow them that connection so they can get that kind of support. Donna, I know I am past my time. Well, I got a few more slides, but I think I might be able to do is just kind of hold off on them because there'll be a little bit more around some like resources. So that might be something we can look to do when we circle back together.
Yeah, okay, that'd be great. And I think the conversation that we're having right now is a great topic to take to our lunch tables. You know, if you can share together, what are some ideas? How can we support our kids and each other in the midst of this pandemic and in the midst of, you know, social distancing? You know, we want to be physically distant, but we need to maintain social activeness. So in social activities, how do we do that safely? And I think Stephanie made a really good point beyond just, you know, for her family, but making sure that parents know it's okay that they're not the go-to, like you were saying, Eric, that kids sometimes need somebody other than mom and dad. And that's not a negative reflection on us as parents.
Nope.
But, you know I needed someone when I was a teenager, and my mom was almost jealous of them for a while. You know, so we just need to know it as parents and teachers, and it's okay to have somebody else, and we need to encourage our young people to talk, whether it's to us or to someone else, to make sure that they understand it's okay to not be okay, and it's okay to have the conversation. And I think conversations like we're having today, and hopefully conversations that will result from this time together, are just so vital now more than ever. So we're going to go ahead and take our 10-minute break. When you come back from the 10-minute break, you will see an invitation on your screen to join a lunchroom. So go ahead and join that room, and we will come back from the lunchroom at 12:35. So enjoy your lunch, enjoy your conversations, and enjoy your time. Thanks. All right, let's just jump in and see what table 1 discussed while we were on lunch. Who is at table 1 and who would like to share? Swear, I'm going to start taking pictures of the table so that I know who to call on.
Tisa asked me if I wanted to share. I told her no. I really
I
don't
think
know.
we
I
were at
mean,
table 5.
we basically just, you know, the question came up about, you know, what can we do to better support our youth? I think that's how it went. And, you know, we all agreed that just being present, being available, just, you know, being supportive, and then also not just supportive to them, but being supportive to the caregiver, whether that be, you know, the parent, grandparent, whether it be at any given time, a school teacher, you know, whoever the advocate is for that young person, you know, because everyone needs the that mental support, just as well as the young person needs the physical and the mental support. We may not, as the adults, need the physical support, but we definitely will need the mental support, because we're trying to support and assist a young person that is dealing with some type of a challenge. So that's what I got from it.
Yeah, that's awesome. That's awesome. Can anyone share with me what, like, some practical ideas? What does, you know, we talked about support. What does support look like or sound like?
I believe that something. I was in group number 5, and I like the idea of being that person that will give the family some respites, you know, like the adult time away from the children and the teenagers, just some time where they could go and have some me time, so they could just woosah, you know, for a moment to you know, to check themselves so that they can be present for the rest of the family.
Yeah, self-care is important, whether you're a teenager that needs time or whether you're the care provider for young people. You know, I think it was Marion who said earlier in the conversation in the chat, you know, we've been stuck inside, and for the first time in a long time, maybe a house of 3 to 5, 6 people in closed quarters for quite a while, you know, and we can start tripping over each other, and tensions can get high and tempers can get sensitive. So I think that's a great idea, making sure that we give each other space and we really focus on some self-care. What do we need to be able to refresh ourselves and be emotionally and mentally ready to care for people who need us? I think that's great.
One of the things in room 5 that we talked about too was showing empathy towards one another. When you have a situation where you do have caregivers who are tired, not only with respite care can we be there for that, but we can just, by showing human kindness and compassion and empathy. We've all been through some tough times, and some people have, their plates are a little bit fuller. And how do we acknowledge that? And just showing empathy is a good way to do that, and say, I hear you, I see you.
That's great. About somebody else in another room, what did you all talk about?
I can share some ideas and thoughts regarding supporting. I wasn't necessarily in a group, but just conversations. And before, when we had our Parent Teen Summit, Mark Gregson, he shared some great tools and tips, especially during the seasons that we're facing today with our students and children. But one of the first thing he says that we just need to have our ears open and listening. And sometimes that's even with our eyes, because sometimes our actions speak louder than our words. So we need to use our listening skills. So we need to listen with our ears as well as with our eyes. And then he said, also give the opportunity for them to talk. I think sometimes that we as adults think we're professionals and that we're skilled and we have life experience, which is very, very true. But we need to allow the students and those that we care for talk and allow them to share their perspectives and their hearts and their struggles. And within that shows what Sandy just shared, the empathy and allowing us to be able to connect with them and understanding where they're coming from. And that also goes with building that perspective and then seeing it from their side, seeing it from their angle, seeing it from their pressures and things like that. And then that just kind of builds the circle of trust there by listening, talking, and having perspective.
Great, thanks for sharing, Jay. Anybody else? Let's open it up then to Q&A with Eric. Eric, if you want to come back on screen and say a few words and maybe pop up your last few slides, we'll go ahead and move to Q&A.
Yeah, we will. Just a little bit of how you can go about talking with somebody if there is somebody that you are concerned about. And here we go. So if you do find that you are concerned that somebody might be at risk, and really even, you know, if you think on the preventative side, you know, they don't necessarily have to be at risk all the way to the point of being at risk of suicide. If you even feel that you sense that somebody is struggling, that somebody is having is in a dark place, reach out to them. And this really stems off of the conversation you all were just having. You know, try to connect with them. Ask if you can talk to them in private. You know, bring those open-ended questions. How are you doing? You haven't seen yourself lately. Is everything okay? Is anything bothering you? And goes, I mean, I really couldn't write this any better than what you all were just saying. Listen to them, listen to their story. And when you're listening, that's when you can express your concern and you can demonstrate and you can show them that you're caring. We don't often listen very well. We hear a lot of different things, but listening is a very exhausting task to do. And listening and being non-judgmental when you're listening, especially when we're talking about youth and young people, not reacting immediately to the things that they're saying, you know, not letting them just I don't want to say vent, because I think it can be even more than vent, letting them show you who they are and what they're going through. If you're concerned, and I'm going to put a little caveat before I get into this piece, this all depends on, where you're at, what role you're in. If you're working for an organization or a school or an agency, you need to follow your organizational, school, or agency's policies and procedures. But if you're just acting as a caring adult, and this can be towards youth or it could be towards other adults. If you feel and you have concern, I always say, if you got that gut feeling that somebody is at risk of suicide, the only way you're going to know is if you ask them. And the only way you're going to get a direct answer is if you ask them a direct question. And you can ask, if they're having thoughts about ending their life. Are you having thoughts about suicide? Are you considering suicide? Asking a direct question will get you a direct answer. Be very careful on how you ask the question, because you might not be asking the correct question. Again, kind of full disclosure, I remember being asked if I was wanting to hurt myself. And the answer was no, I was not wanting to hurt myself. I was actually wanting my hurt to go away. And the only way that I could see my hurt going away was to end my life. So you have to be mindful of what you're asking, because they're going to be responding to the question that you ask. And once you've had an opportunity to listen, once you've had an opportunity to kind of let that person, share what they're going through with you, we always want to look to connect people to appropriate professional help, to the mental health services available in our communities. I'm going to share with Donna. It's a very simple little trifold brochure thing that has some of the local resources, the community mental health centers here in Northwest Indiana, as well as where some of our inpatient services are. One thing that we struggle in Northwest Indiana is youth and adolescent inpatient services. But I'm going to share with you what we got. We want to take the person seriously. This can be challenging with young people. There's this idea sometimes that people are just seeking attention or trying to get a reaction or a response. And you might find that is the case, but I still think that taking them seriously and making it a learning opportunity for them. The National Suicide Prevention Lifeline, here's the phone number to it right now. It's going to be converted into a 3-digit number here in the future, but right now this is still the number. This is a great resource. It's a great resource for people themselves who are struggling, that would benefit from talking with somebody, having somebody who can listen to them non-judgmentally, a crisis counselor. But this is also a really great resource if you are there, if you're concerned about a loved one, a friend, a family member, where you can get information and how you can best help somebody. So I always encourage kind of people on both sides, those who are struggling and then also those who are their support, to call the Lifeline. If in the conversation they did express that there is a plan, and they did express possibly what the lethal means that they are considering, do what you can to remove those lethal means from them, and then escort them to appropriate professional help if you can, depending on your relationship with the person. The emergency room is not necessarily the ideal place to take somebody. Oftentimes I would discourage the emergency room. However, it might be the only thing available to you. And if that is the case, please do that. But we want to try to connect people to different counseling, psychiatric services. So these are just kind of 3 kind of basic resources. The Suicide Prevention Lifeline, which is available 24/7. I think it's 40 some different languages. So it's a great resource. The crisis text line is one that is, it's an opportunity if you're somebody who, somebody prefers to text more than talk, that is a great resource. So you just text the letter IN to 741-741, then you would get a crisis counselor that'll be texting back and forth with you. The Trevor Project is a really great resource specifically for LGBTQ youth. Their crisis counselors are vetted and well equipped to be able to speak towards LGBTQ unique issues. And then lastly, the state of Indiana, the Division of Mental Health and Addiction, has a kind of wellness campaign and strategies that they're bringing about through their bewellindiana.com. So it's just encouraging overall mental health and wellness. And then
Very
the last thing is just kind of contact information for myself or Maria Elena if you want to learn more about the Suicide Prevention Council or training opportunities and stuff like that. You can always connect with Donna or myself or Maria Elena.
Thank you, Eric. Dan Edwards had his hand raised.
Oh, actually, I'm good. I think he answered it. But I mean, I just wanted to comment that, you know, way he said that you got to come alongside and ask questions such as those questions. But immediately, you know, they're not going to respond right away because they're afraid of the outcome of the situation or, you know, the cause and effect. So, I mean, it just takes a lot of time to come alongside and, you know, hang out with somebody to kind of get.
We lost you, Dan, or at least I did.
I think one of the things that
to do when it comes to an individual. Yes, sir.
Oh, no, good. We lost you there for a quick moment, but I definitely, you know, I think one of the things is it's that rapport, like you're saying, building that rapport, building that trust. And especially with young people, the concerns and the fear of repercussions or punishment for sharing, you know, is real for, especially for young people. If you want to think about being vulnerable, you know, telling somebody that you are having these kinds of struggles or these kinds of thoughts, I mean, there's not a whole lot more vulnerable times. And so, you know, bringing that empathy that was mentioned earlier, building that rapport, listening to them is really going to help them be connected. And through connections, you know, through connections and relationships, we're able to help people and hopefully prevent further suicides.
Eric, this is Trina. I just wanted to say, I really appreciate what you just said earlier about the way we ask the question. It's important in making sure we ask it correctly, because I don't know that I ever really thought about the difference in asking if are you trying to hurt yourself versus are you wanting to commit suicide, you know? And then the idea to even say that aloud is almost, I don't know, a little scary to just ask someone that, because you know, you tend to, I don't know, sometimes the way people are raised or whatever, that you be respectful. You don't just ask things like that, but you find a way to try to ask that question without causing any more danger or any more harm, you know. And so it's just good to hear that, because I don't know that I've been in this thing for a long time as well, but you know, you tend to forget things as well. And maybe it's just a refresher, but I really appreciate hearing that. Thank you.
No, thank you. And I've gone through a number of different kinds of trainings. One of them Donna actually does, which is called like an assist training that helps you when you're kind of in that moment with somebody who is struggling, and how to ask the question and kind of not the digging deeper, but how to keep bringing more questions to help learn and gather. But I think the biggest thing is you have to get a direct question to get a direct answer, you know. And I think kind of one of the things that Dan was speaking towards a moment ago is you might not get an answer right away, or you might get an immediate no, because the person is probably caught off guard. They probably are surprised that somebody's asking them this question, and they're probably scrambling in their heads. They probably had a quick initial no response. And that's when keeping the conversation going, demonstrating that you're caring, demonstrating that you're listening, bringing those open-ended questions around, you know, like, you know, the I statements, you know, I've noticed you haven't been whatever that is that you've been noticing. And then if you're still having that concern, ask them a second time. And, and I don't want to say research shows because I couldn't tell you exactly what research, but I know I've been in trainings like the assist training and other kinds of trainings that do have the research behind it. But it's oftentimes the second time you ask that question, you've demonstrated and you've almost proven that you truly do care about them. You do care about their well-being and their life. And because nobody wants to burden anybody else, so that you know that if you tell somebody, I want to die, I want to end my life, how much more of a burden can you put on somebody? And so unless people know and they really feel as though this person does truly care, especially young people, they just don't dump that information. And if you think, one more thing, Don, and then I'll let you know. If you think you're going to have to ask the question, or practice. I practiced in the mirror for a long time, looking, because it's very hard to ask this question out loud. Practice in the mirror, practice looking in your own eyes, look at what your face is doing, because my face tells you what I'm thinking. And if I'm afraid of the response, you're going to see that fear in my face. And if you show that kind of fear when you're asking the question, they're going to want to protect you and they're not going to want to burden you. So it's a lot of pieces combined, but there's opportunities to kind of learn how to do this. And I definitely would encourage, if this is of interest to you, or you would be beneficial, which I think it is beneficial for everybody, try to see if you can find one of those opportunities to really learn, to continue your learning around suicide prevention.
Yeah, Eric, I think this is a good opportunity too. And people may be wondering if we mention suicide when that's not on a young person's mind, if they're just having a bad week or a bad month, or they're a little sad, if we mention suicide, excuse me, are we planting ideas in their mind or giving them an idea that they hadn't thought about? And again, not to use the research says, but it does show us that that's really a myth. We're not going to plant that idea in their mind if that's not something that they're already thinking. And to Eric's point, if we're confident and comfortable in asking the question and showing that we truly care, then we bring relief to people who may be feeling that way, because they're finally being seen and being heard and given an opportunity to share their hurt and their helplessness with somebody who's come alongside and they feel comfortable. It's there to help them. And that's the biggest thing, is that we really want to bring that hope, sense that there is someone there who cares and is there to help them get the help that they need.
Absolutely. And it's not, you're asking the question, you're not encouraging, you're not, someone who has not had thoughts of suicide and is not suicidal is not going to become suicidal by asking the question. And it's not a question, you don't typically start with that question. You start the conversation based upon what you have been observing, and that's where you would start, is sharing what you've been observing and those open-ended questions. How are you? And it's okay. These conversations are oftentimes things that can take place over a period of time, especially if this is somebody close to you, a family member, a friend, or maybe somebody in your workplace, a coworker or a client you're working with. These aren't things we typically see and recognize immediately and have to ask the question immediately. There's typically a history and a rapport and a relationship that has been taking place. And so, yes, there is this myth that by asking people if they are having thoughts of suicide, that we are encouraging them to consider suicide. But I mean, that is not the case. If you're not suicidal, you're not going to become suicidal. It's to help those people who are struggling, who are in this dark place, because when you are in pain, and the pain is here, it's in you. You could do your best to hide it and keep it from everybody else because you don't know what to do with it. The only way to learn about that pain and to learn how to help them is by asking questions and listening to their responses. and demonstrating that you do truly care. So I would say if you have those feelings, I don't have my gut just to keep me warm in winter. If I have that gut feeling, I'm going to follow that gut feeling and I'm going to ask those questions if I need to.
Eric, thank you so much for being with us today, for sharing your expertise. Thank you, all of you, for sharing your insight and asking questions. Thank you for caring about our young people and being here month to learn and to grow so that we can help them as best we can. Next month, we're going to be talking about tobacco and vaping. Carolyn Higgins is going to be with us. So it should be a really interesting hour or so with her. She's going to tell us about some programs that are out there and available, especially for those of us here in Northwest Indiana. They're available through the Tobacco Coalition free of charge. And I know that that's something that's supported nationally, so she can share some of that information with you. We will get the recording out to those of you who have registered. We will be sending you an email with the documents that resources that Eric mentioned, a copy of the information that he shared with us today, and the survey. Please take a moment. It's only about 15 questions. It takes less than 5 minutes. Please take the time to respond to our surveys. That's how we know that we're doing what you want us to do and that we're meeting your needs, which is really why we're here. So thank you. Thank you again, Eric, for being with us today. Thank you, everybody. You have a great afternoon.
Thank you, everybody. And I'm just going to respond. I saw where Stephanie just posted something in the chat box. I'm going to respond to Stephanie. Feel free to do what you need to do, everybody else. What about the deaths by suicide that have been encouraged through social media? I'm going to stop sharing because that's a tough one. There have been some situations where some people who have been encouraging suicides, encouraging people to attempt or encouraging people to die by suicide, have been prosecuted and have actually been found guilty. It's something that we have not seen a lot of, but it is definitely something that we have seen a few situations where young people have been telling other young people that they should die. I think, this really is kind of that giving kids that safe space and an opportunity to come to us if they are on the receiving end of it. And then I think, kind of like that bystander role, encouraging our young people, if you see somebody else doing this to somebody else, you can also step up and say something. While that might be, there's different ways in which different apps and things work, and I don't even want to pretend like I know what they are or what they do and how they operate, because they change all the time. But oftentimes there's an audience in these chats or in this delivery of messages, and really encouraging and connecting with our young people to know and understand that if you observe this kind of behavior, that you also need to step up. And if you might not be able to be the one to intervene, but get a trusted adult who can intervene and can show the person who's receiving these kinds of messages the love and support and care that they need. But then also looking at the person who is encouraging this kind of behavior, because that person is probably struggling with some things on their own, because a person who is in a healthy emotional and mental state of mind isn't going to encourage other people to die. So I think both people in this situation would benefit from getting help. So we need to kind of take that bystander approach and encourage our young people to connect if they do see that kind of behavior happening, reach out to adults, so trusted adults who they know can intervene on with the best interest for everyone involved.
Yes.
Hurting people hurt people. That's exactly right, Donna.
Good question, Stephanie. And fortunately, to Eric's point, it doesn't happen often, but it definitely happens. I think that's where, Stephanie, you were the trusted adult that someone reached out to late one night, right? When they were in a conversation with another young person who had shown signs and symptoms of being suicidal, and you were that trusted adult, and an intervention was able to happen. And I truly believe that you saved a life that night. So it works. If we do it works, right? That doesn't mean that we're going to save every life. That would not be realistic, but we can try. We can try. So if there's no other questions, thank you again for being here today. Eric, thank you so much. Thanks.
Absolutely.
It shows.
Absolutely. And all of you, like, if those who are still here, I should have said this before everybody else says, do something kind for yourself today. This is a heavy topic, heavy thing to
Yes.
talk about. So be certain you do something kind for yourself today as you're finishing kind of processing this conversation. So thank you, everybody. And I hope you have a great rest of your day.
Thank you. Reach out to Eric or I if you have any more questions or are interested in any of the training on this subject. We're here to help. Thank you. You all have a great day.